and good afternoon, everyone. My pleasure to podcast this study with you in the fields of regenerative endodontics, titled Patient-Centered Outcomes Among a Cohort Receiving Regenerative Endodontic Procedures or Apexification. This is a retrospective cohort study done in multiple centers to compare the two treatment modalities done for immature teeth with necrotic pulp. Several studies has been done previously, and they found that regenerative endodontic procedure had a slightly lower success rate in comparison with apexification. So just to know the difference between the two, in REP procedure, it is a procedure completed in a minimum of 2 visits with standard initiation of local anesthesia, rubber dam, access, and working length, standard irrigation of sodium hypochlorite, chlorhexidine, and with or without EDTA, minimal or no instrumentation, and the placement of an intracanal medication, calcium hydroxide, or antibiotic. And the completion visit, there should be an induced apical bleeding by laceration of the apical tissue. MTA or biodentine is placed at an approximation to the cement to enamel junction, and then it should be sealed with composite. The aim of this REP procedure is to have a continuation of the root formation and increase the thickness of the root walls dimensions. And the apexification and the calcium hydroxide apexification, it's a procedure completed in a minimum of 2 visits with a standard irrigation and instrumentation. And the calcium hydroxide is placed in the canal until an apical barrier is observed radiographically, and then the case will be continued with obturation of gutta-percha and AH plus sealer and composite. For MTA apexification, it's a procedure completed over a single or multiple visit with a standard irrigation and instrumentation. Calcium hydroxide is used as a medication to eradicate the infection, and then an apical plug of MTA is condensed apically, and the remaining canal space is obturated with gutta-percha and AH plus sealer, and then it should be sealed with composite. And in this study, they wanted to compare between the two procedures and what are the factors that affect the outcome from a patient perspective. The patient-centered outcome in this case is to have an asymptomatic tooth functioning and no need for further treatment, while the clinician-centered outcome is having absence of signs and symptoms, radiographic evidence of healing, and formation of apical barrier, and increase the root wall thickness in case of REP. In this study, the methodologies they did, as I said, it's a multiple center done in New York, Boston, Washington, Harvard, and San Antonio dental schools. They had a total screening of more than 3,000 cases, and they ended up with an eligible cases of 211 case. The etiology of necrosis is either trauma or caries, and the age of the patient is between 10 and 11. All cases were treated by endodontic residents following the AAE guidelines between the time of September 2009 and December 2014, and they ended up with 93 cases treated with REP, either used antibiotic paste or calcium hydroxide with an average follow-up time of more than 33 months, and apexification procedure in 118 cases with an average follow-up period of 31 months, either treated with MTA or calcium hydroxide medication and gutta-percha root filling. And they wanted to compare now between the outcome between these two procedures and what are the factors that affected the outcome. And what they found was in line with the previous studies that REP had lower success rate from patient-centered outcome. And to do this, they did Kaplan-Meier survival graph, and it showed that REP generally required additional endodontic treatment earlier than those treated by apexification procedure. For example, at 1 year follow-up, 99% of all teeth in the study treated by apexification were successful, compared with 93 of teeth treated by REP, and the divergence increases as the follow-up time increases. The factors that might affect this divergence is either having a pretreatment periapical radiolucency, the etiology of pulpal necrosis, either trauma or caries, and having an anatomical anomaly. But they found that these factors did not impact the outcome significantly. By digging deep in the analysis, they can find that the type of procedure itself, either by doing apexification or REP, will affect the outcome, and having a preoperative infection and the stage of root development, but still they could not definitely conclude whether they are 100% associated with the earlier time for treatment failure, but they are the most susceptible causes for this failure. Also, going back to the type of procedure itself, it is the most susceptible cause. However, the type of irrigation did not affect the outcome, but what affected it the most is the type of medication used. All cases with REP in this study were medicated with calcium hydroxide or antibiotic based, and they found lower success rate in the cases of calcium hydroxide. And these are, as stated by the authors, are area for further investigation. The limitations of this study, as stated by the authors, are the small window of percentage to study the failure cases. As stated here, the difference is less than 10% between the two procedure and the success rate or the outcome. And this did not allow for increasing the studying the variables. So this suggests that more cases should be included with longer follow-up time. That's it for this study, and if you have any question, don't hesitate to contact me.